There appears to be none.
Mr Chair.
The Honourable Simon O'Connor. No, sorry. Promotion.
Oh, well, the healthcare sector.
Plain old Simon O'Connor.
Thank you very much. Mr Speaker, I'm very pleased to take a call in this debate, particularly to follow on after the Minister. In fact, it is a debate because there have been so many inaccuracies coming from the other side, and we'll put pay to a few of those, as well as being able to go through some of the great successes. But I will say right from the outset that the New Zealand healthcare system is in excellent shape. The best shape it's been for many years, and I think a lot of that acknowledgement goes to the current Minister, and want to acknowledge here the very positive working relationship. In fact, the positive working relationship that the Health Select Committee has most of the time, bar when selective choices are made out of the New Zealand doctor, and I'm sorry that I have not bought my copies over the last few weeks to be able to actually table those positive stories as well. Mr Speaker, incredibly, Mr Chair, very, very good news. Vote Health has increased 4.8%. 4.8% increase in this budget, $16.142 billion. That is an enormous, enormous spend, the largest it has ever been, and in fact a huge amount of money actually going towards the DHBs. I'm not going to break down every cent of it, but two mistruths have to be immediately noted. The first is that actually funding, and as it is calculated, has fully accounted for all the demographic and cost pressures, over the last 8 years. That has been completely and fully put in. We also have to put pay to the absolute falsity, Mr Chair, which is put out from the Labor Party in particular, that there's an underspend of $1.7 billion that they're up to at the moment. An absolute falsity. For two reasons. First and foremost, it's absolutely matter-of-fact, ipso facto, that when you are increasing the budget by 4.8%, taking it to its largest of $16 billion in increase, you cannot be in deficit of $1.7 billion. The second element, very clearly, all comes down to actually how the money is spent. The dollars are increasing, but as the Minister himself indicated a little bit earlier, how it is spent. We know before we came into this government, for our shame, that all the money that was being thrown into the healthcare system still didn't fix the problems, did not increase the number of surgeries, did not improve the hospitals, did not increase the vaccination rates, did not improve immunisation, and in fact, I do those negatives because since 2008 and continuing in this budget bid, positive increases into the health system. So I just want to touch on a few of those. We are continuing down the line of free health care for those under 13. An absolute recognition of the importance of those first 13 years of life, not only, of course, of visiting your general practitioner, but getting the pharmaceutical products that you need. We've heard a lot about bowel screening. In fact, we heard from the previous member that bowel screening was Labor's idea and implemented, which would be pretty remarkable if they don't have a TARDIS, seeing as, in fact, this government which started trialling it in the Waitemata, and it's this government in this budget which has found the money to roll it out across New Zealand. And look, we were just a couple of us at a talk tonight with some doctors from the New Zealand Medical Association. They were highlighting to us, amongst other things, the real importance of actual screening programs, and we spent a little bit of time actually talking around the whole question of bowel screening. This is one of the top 5 reasons that men die. In fact, it's the top 5 reasons for both men and women, but higher for men. This bowel screening project, the whole point of bowels is they are down to the south, but we're not going to get into the medical stuff here. Look, this is a fundamentally important program, and the money has been fronted up to assist this. Importantly, too, there are money for the other forms of screening which are required here in New Zealand. Look, money has been put aside, I think, really importantly into primary care, particularly around that of mental health care. And I know members on the committee have raised issues around mental health care. Having worked in that sector indirectly over the years, it's an understanding that, in fact, there's always going to be more to be done. But I think actually this government, through this budget, has shown real commitment, first and foremost by an overall increase in funding for mental health. but as I'm articulating here, particularly the $35 million into primary care, that's where often, Mr Chair, issues are manifested, are first detected, and I think the ability for GPs obviously to assist in that pathway is important, but personally I'd like to see through this funding, excuse me, Mr Chair, that actually this, Mr Chair,
Simon O'Connor.
Thank you very much, Mr Chair. That funding is going to actually enable and strengthen the GPs themselves, because again, it's not simply about the money. In fact, if I can link it back to what we heard a little bit earlier, we were looking into the science of happiness tonight through a medical doctor, is saying that simply having money is not going to make you happy. In fact, service and connection is going to make people a lot more happy. And I think there is a direct metaphor, if you will, into this budget, that it's not simply about spending more money, but how you actually increase the connections. We are going to see that, I believe, with this funding around primary care, mental health support. We have seen already the connections through, is it something like 50,000 extra elective surgeries, and even more money has been allocated for more surgeries. If you've had any engagement in the health sector, including my very short time in the private healthcare sector, hips, joints, all of that, rotator cuffs, the whole lot, there is an enormous amount of work that needs to be done, and this government is spending the money required. But not just on that, around elements of pain management. There's been funding in this budget, Mr Chair, to increase how we work with pain management, and that manifests itself in two important areas. Firstly is the creation of pain teams. This was an announcement in the last budget, but has been increased and is furthering in this current one, is bringing around doctors, nurses and other care professionals of excellence to help people manage their pain. Again, this is not simply about replacing the hip, but how do you get an orthopod or an OT, a nurse or your GP to help you manage through that. The second is around something very dear to my heart, which is palliative care. More money around palliative care, and in fact we have a program in place at the moment engaging with the sector. I'd be remiss, Mr Chair, if I didn't raise Pharmac and the enormous amount of extra funding that has gone into Pharmac. Look, we could do enormous well, we are doing an enormous amount in this space already. A number of us had the privilege of listening to Pharmac last week, who came and gave a briefing to all MPs. Remarkable what is already funded, but millions and millions more dollars in this budget to Pharmac to bring about a change, particularly in, well, actually 7 areas. I'm not going to go into all of them. The most notable is around melanoma. Of course, remarkably, this government has not only been able to fund Keytruda or pembrolizumab, but is also funding Opdivo from another company, enabling a very comprehensive approach to this. Importantly too, and we've discussed it in the past in this House, around new treatments for hepatitis C. The committee members here in the House will absolutely be aware, particularly when we went through the Health Protection Amendment Bill, the cry, the call from the community for these drugs. Pharmac can now fund those along with 5 other drugs, and are continuing to look at positive ways forward. That, Mr Chair, has been enabled not only by the hard work of the people at Pharmac, strong negotiating and engagement with the sector, but the extra funds allocated in this budget. It's not quite Pharmac directly, although naturally it touches on them. They buy the immunisation products required, the vaccines, but actually it's this government which has successfully targeted, not only obviously in the flu sector, that's for everyone, but we need only think of rheumatic fever, and the variety of other vaccinations that are required. Stunning results through extra funding, not just across the sector, but particularly into Maori and Pacifica communities, which often statistically lag miles behind. And in fact, I believe, and I'm happy to be corrected, but I believe actually, particularly around rheumatic fever, Maori and Pacifica rates are higher, Mr Chair, than Pākehā rates, and I think that is absolutely fantastic. I think an immunisation, in fact, I'd be interested to hear more of that. That's my understanding. I am just talking off my general thoughts and what I've read rather than specific notes, but I think there's been remarkable results there. We're seeing more and more funding into areas such as the work on the health lines, We're seeing more funding into the DHBs. They are going to go from strength to strength. One of the elements I am seeing is strong and positive communication with the sector, not only into us as members of the Health Committee, but to the Minister, and we must continue to be as responsive as we can. Look, I'm conscious I'm going to run out of time, which is unfortunate, seeing there's actually a whole lot more to be said. But one thing I find manifests itself in my own electorate is the money around $18 million of healthy homes.
Kevin Hay.